Hey guys, welcome to the Tetra Health and Performance Podcast. Today we're tackling the shoulders, and this goes deeper than what you think, not just the shoulders, some hidden stuff in here as well. But before we get into it, this is a great time to like, subscribe, hit the bell notification if you're on YouTube to get subscribed and notified when the episodes come out. Guys, this is a cool episode as well to jump on YouTube. We will be using some visuals here to kind of drive home some points. So your preference, but like if you want to jump on YouTube, you kind of see some of these movements in action that we're going to describe. And a quick disclaimer here, we are going to go into a bit of anatomy. So we'll do our best to explain this, but go along with us. And if you want to understand the deeper nuances about the shoulders and get the most information out of this, stay with us through the anatomy course of it. But if you want to jump straight to the end and see the training tips and the more usable aspects that you can integrate into your training, we'll chuck the timestamps down below and we can just jump into that segment. But do recommend knowing why you're doing these training tips and listen to the first half of it. Let's get into it.
Straight into the anatomy side of things then, I guess. So we'll try and be as brief as possible with the anatomy side of things and try and get the point across as well as possible. But the shoulder joint is probably the most complex joint because of its lack of congruency. So as the joint actually doesn't actually fit into a joint. So a congruent joint is a joint that kind of molds perfectly around the joint. It has two joints that mold perfectly together. And in this case, the shoulder joint doesn't really have that. We can kind of picture it as like a ball and socket joint. And a golf ball on a tee. And if you can kind of picture that, the golf ball being quite big and the tee being quite flat, they're not really cupping around the top of each other like other joints. So the idea, it relies on tons of tissue, which we call the rotator cuffs mostly, to then engulf that tee and that golf ball to hold it in place during very complex movements. And with the shoulder joint, it has so much freedom of movement. Like you can think about what you can do with your arm. You can pretty much put it anywhere and everywhere. And while that's like an amazing advantage, with that amount of mobility, you also need to have a good amount of stability. So that's a really complex joint. And with big muscles around it, they all need to coordinate really, really well. So that when I use a big, strong muscle to lift my shoulder up and overhead, I need all these smaller muscles to couple with that action to hold that joint in place so it doesn't just get pulled out. And we can think about like shoulder injuries like that are quite common, like subluxations. Dislocations are extremely common with shoulders, and for that exact reason. A little bit of terminology. When we say deltoids, a little bit of terminology like a glossary. When we say deltoids, we mean them big shoulder muscles on the shoulders, right? We have we have different types of deltoids. We have we commonly believed previously was that we had 3 deltoids. We had an anterior delt, a medial delt, and a posterior delt. But the truth is actually recent research has found that there is 7, and each of them muscles has an intramuscular tendon, so a tendon in between to actually split them up. The way they break it up is they say they have 3 anterior, 1 medial on the side, and then 3 posterior muscles. So, and I think the cool thing is when you look at this in bodybuilding magazines or like bodybuilding photos on the internet, you can see them 7 heads. We've done it ourselves. We've Googled shoulder muscles, Googled some professional bodybuilders, and we've seen, okay, you can see all 7 heads. With that in mind, like other muscles, like the shoulder joint being so complex, we have to consider all the other muscles that travel from the shoulder blades through to the collarbone, through to the arm itself, and into the rib cage. And that in mind, there's actually the shoulder joint technically is not one joint. We call it the glenohumeral joint, which is the main joint of the shoulder, but there's actually 4 other joints. There's a joint that connects the collarbone into the collarbone into the, help me guys, collarbone into the scapula, and there's a joint that connects the scapula into the rib cage, and then there's the joint that connects the scapula into the actual arm. Yep. Well, with the little amount of congruency between the actual glenohumeral joint, we need the complete opposite with our rib cage. So our scapula is actually supposed to be complete. The scapulothoracic joint is a really interesting joint because it actually relies on just being flat and congruent on top of the rib cage. So that's a really interesting joint because it's actually kind of like a floating joint. It has to stay on, it has to glide up and down between like the 4th and the 7th rib. But it's very important that they actually are flat on each other, or not even flat. One's concave and one's convex, and they sit on top of each other very congruent. And this is where we see a lot of problems arise, and this is something we're going to talk about a little bit more in a bit. One more thing that I think is super interesting is shoulders aren't actually most people think that our medial delt is completely on the side of our shoulder, but we have something called the scapular plane that sits at about 30 degrees. So my arms are always my upper arm is slightly retroverted. It means it's turned back into the capsule. And that's normally about 30 degrees for most humans. And we actually only get to about 30 degrees when we turn about 18 to 20, when we enter adolescence. We actually are born with them at about 65 degrees retroverted, so they're actually more turned forward. And then over time, as we get to about 18 to 20, they settle at 30. So a really important thing to bear in mind with that is that actually if you played any like baseball sports, overhead sports as a kid, what they find is you normally don't turn back quite as much. So your throwing arm is normally slightly more retroverted than your other arm by about 15 to 20 degrees. I think it's very important to look in later in life. So one of the reasons why when we screen someone, we ask them previous sporting history. Because that's going to tell us a lot later on down the line. It's going, so you played an overhead sport all the way from 12 to 18 professionally or semi-professionally or at a high level. And that's going to tell us a lot about what we can expect the shoulder to be able to do.
Yeah, and in terms of what a shoulder can do as well, I think you're going to touch basically as well on what the movements are. So some of us are familiar with the shoulder and it does tons of different movements, but there are specific anatomical terms that they have if you wanted to quickly go over those for the audience and visualize what they might look like.
Which ones?
You got your external, internal rotations.
Oh, of course, yeah. So we got to talk about all the. I did say how the arm goes up and around and can move everywhere. Well, they kind of call that circumduction, but circumduction is not really a movement as such. We have what we call like a flexion of the arm is when I take my arm up and close the gap of the shoulder. I have extension is when I take my arm back as far as possible. I have abduction when I take my arm up to the side. Adduction when I take it across to my midline. And then we have internal and external rotation. And internal and external rotation, these are different axes, but we have like, normally we confirm it as internal rotation at 0 degrees, which is quite often what we call an Apley's test. You've probably done it before where you take your arm up and scratch the opposite shoulder blade. And then we have external rotation at 0 degrees. Then we have internal at 90, where I just take my elbow up to the side of my body and take my hand down, and I have external rotation at 90 degrees. And these are important things because we use these for testing as well.
Interesting thing with that too, those movements we referencing are applying to like the humerus, that big arm muscle right up, or big arm bone up here. But then we do have movements that occur at the back of the shoulder blade, that big bony structure, that scapula. That's doing different movements as well, like those same movements we described, but different to the arm. And then there's also different movements that occur through the rib cage as well. So it can get a little bit complex, but understanding some of these terms gives us a lens to how to look at movement and use common language to make sure everyone knows what we're talking about and how to make changes to the structure. A cool one too, like if you want to jump into the video links, we're going to share how to test your shoulder range. So I'll have a video for shoulder range, a video for training for hypertrophy, like how to put some muscle onto the shoulders. And we're just going to show you how to increase some of these ranges by doing a really cool shoulder warm-up that's going to put you in a really good position to accept more ranges and to move a bit more efficiently in your sessions. So check that out down below, guys. There's some really good videos that'll help you out.
Yeah, I think one more important point to touch on before we move on, if we're talking about scapulas and how that moves the arm as well, I think it's important to let the viewers know that that scapula is the shoulder blade on the back, but it also sits with the glenoid fossa. So when we say glenohumeral joint, that's in reference to the glenoid fossa on the side of the scapula there, connecting to the humerus of the top of your arm. So that's how that shoulder blade interacts with the top of your arm and how it has effects on different movements that we do with our arms there.
Yeah, exactly. And when it comes to the like Mitch just said there as well, is that when we're looking at the arm, we can't just look at the arm on its own. So the arm is connected into that fossa, into the scapula is then connected onto the rib cage. Well, the ribs are connected to your spine. And every single movement that we do in the body is in some way going, especially walking and locomotion, breathing, is in some way going to tie all this in together. We find that we were discussing, what was it, Callan, a previous screening of the shoulder that was actually turned out to not be very effective for certain reasons. What was it called?
The Kibler classifications.
Yeah, so the Kibler classification, for example, was looking at shoulder blades and determining the shoulder blade from its position and with one quite simple movement. But because the shoulder complex is so complex, they kind of ruled that out as a good way of testing. And you can kind of imagine why. And I think of like most movement is 4D, right? We have these 3D movements, but then we have to add the 4 in, and the 4 is time. Right, so the movement between shoulders and different muscles and joints is so complex. Why one's slightly moving slower, it can be moving at a different direction at the same time. So you can't just classify it from one test. You really have to look into the whole thing as a lot. And the cool thing about that is, I think lots of people don't really realize, but if I, for example, take my right arm and place it out in front of me and I turn my palm up, Well, what actually happens there is I actually get movement of my shoulder blade, and I actually turn my whole spine in towards the arm, and I can't resist it. And then as I take my palm and turn my palm overhand, I actually turn away. That changes my shoulder blade movement. So if I rotate to the right, my right shoulder blade is actually going to retract, and my left shoulder blade is going to protract, which is one coming closer to the spine and one reaching out. If I side bend to my right shoulder blade is going to upwardly rotate, and my left shoulder blade is going to downward rotate. If I flex my spine and bend over, then my actual shoulder blades come up and around, and if I extend my spine, my shoulder blades come in and back. So they're all tied in together. The way my spine moves with the way my ribs move is going to facilitate how my scapula moves, which is going to facilitate how my arm moves.
The big point to drive home there, it's an integrated system. There's a lot of areas that are working together. And when we talk about shoulder, I know it's funny, but we're also talking about ribs, we're also talking about the pelvis, and we're also talking about the feet and how we move. And again, I think it's maybe an error with our lens sometimes to look at a muscle from an isolated standpoint when there's an injury or from a movement lens. But having the idea of, hey, let's step back a couple of steps and let's see how that interacts with these different structures, we can get more information out of it, and we can see how this interrelated relationship works, and then we can pick better movements to facilitate better results, whether it be from breathing and movement mechanics to strength work to performance outputs. We can see the shoulder integrating as a unit to get the best performance out of it.
Yeah, and one that Mitch didn't mention there is that your gait and locomotion mechanics are going to play that big role. And when the two lenses, the breathing lens and the gait lens, can be exceptionally helpful in kind of targeting how someone what kind of position someone may not be able to take up. And you can kind of think of it like posture is a really interesting one with this, because there is going to be certain postures or positions. Well, again, with 4D movement, a posture on its own doesn't really matter. Like if I have one static posture, if I stand in a certain way, it doesn't matter if I can actually then take up the different posture. So again, time really matters. The ability to actually move through space is way more important. But if you are stuck in certain positions where you do have this kind of forward head posture, your chest is down, then it is going to be exceptionally hard to get your arm overhead if you can't get yourself out of that. And we can kind of look at that also through breathing mechanics. Well, for me to get this first off, for me to be able to have my scap on my rib cage and get these full availabilities of movement, I'm going to actually need that kind of kyphosis of my back. And that kyphosis of the back shows us pretty much that we can breathe into our back. So if you do become this chest breather, belly breather, there's certain situations where you actually will lose range of motion through your arms because your scapulothoracic joint actually doesn't fit congruently onto each other, so you lose range of motion.
I think you can do a nice little fun way to drive this point at home if you're listening. If you just put your hand up and you slightly curve it, you can picture that's the rib cage. And you bring the other hand and you curve it on top. That's the back of the scap. And they kind of hug on each other. And now if you move your top hand, you slide it up, you slide it down, you rotate it back and forth, they're moving on top of each other and gliding on top of each other. Well, the scap is gliding over the rib cage. And that's the relationship we're looking for. But now, if we take our hands again and we flatten one of our structures, so we flatten one hand, and then we put the curved hand on top of it, there's now a lot of space, and now it's not as congruent, and we've lost that good movement that would want to be desired through the rib cage and scap relationship. So when we're talking about that, that's what we want to see, those two curved objects sitting on top of each other to get that nice congruent movement and more freedom of movement for us to use in our daily lives.
And when we talk about that as well, it's that relationship and how when we move our spine, we get different movements for our shoulder blade. This also happens when we inhale and exhale. And that's how we tie in our breathing as well. Just a nice simple explanation. It is way more complex than this because it's a full body movement. But for example, when I exhale, I actually have my shoulder blades retract. Yep, they actually adduct. Yeah, they posteriorly tilt and they downwardly rotate. Yep, and when I inhale, I get the opposite. I get this shoulder blades actually coming out because I flex my spine more. They actually upwardly rotate and they anteriorly tip. So it's that every time I inhale, exhale, every time I take a walk through movement, every time I bend through my spine, I'm going to get some kind of scapular movement.
It's cool. You can just think about it. If you're listening right now, just take a nice, calm breath in, and you can feel the whole structure start to expand and move in an outward direction. Then we take a nice, soft, long exhale, and we can feel the structure start to drop down. And having that movement through the rib cage and through the scaps is huge. And if that doesn't happen, well, then we've got something to look at and something to start off with as well, trying to restore movement in those areas.
And Mitch just said a really important word there in a sense. It's the word expand. So For our shoulder blades to be able to move, you can imagine how if I need this kind of kyphosis in my upper back for my shoulder blades to be congruent, then I'm going to have the ability to expand or breathe into my back, right? Well, what actually happens is for me to take my arm all the way overhead, I'm going to need these different levels of expansion up my spine. And we can, it's pretty cool that we can actually organize parts of the rib cage to certain shoulder movements. So if I have my arm down by my side, so when my arm starts going up, from about 0 to 60 degrees of arm movement, there's actually no shoulder blade movement. So most people, even with frozen shoulders, can clear 60 degrees, right? You can pretty much always have that 60 degrees, which is pretty cool. But then for me to get up to about 90 degrees, I actually need the muscles of my kind of lower rib cage to relax to allow my shoulder blades to start moving upwardly. Yep, and then for me to go a little bit higher than 90 degrees, I then need the muscles in between my shoulder blades to actually relax to allow the shoulder blades to upwardly rotate even more and elevate. And then for me to actually clear directly over my head, I need the very upper back, the muscles of my neck to be able to, muscles of the posterior neck, front of the neck, upper traps, for example, scapular elevators, levator scap, muscles like upper traps I mentioned, rhomboid minors, these kind of muscles to relax for me to go completely overhead. So we can actually look at someone, we can do a little test, and we can go, oh, well, actually we can just do some breath drills to actually force some air into that part of the rib cage. And air being, the cool thing about air is it follows the path of least resistance. So there is certain positions where we can kind of control certain muscles to stop air going there, so we can make sure air goes to the place we want. So it can be just a position of your arm, right?
I think this is a huge point James just illustrated there. And we use this every day in the gym to pick positions that fit people a little bit more to their natural abilities. And we can get more out of them, like if they don't have ranges. We can put them in a more safer range for them and still load them up and have them in a very safe environment. So again, check out the link at the bottom. You can test your own shoulder flexion. You can kind of find a range that suits you a bit better. And there's heaps of ways to put you in nice positions and load the hell out of you. So if you maybe don't feel comfortable with your hand fully overhead, we can still train the hell out of the shoulders or whatever areas that we're targeting by manipulating the body to be in a slightly different angle, and we can still get a heap of load on this. This limb arc model that we play with is huge, and it just gives us more educated decisions with our training, with our movements that we're using for our training. And we can just, like we said, people with frozen shoulders that have like no range whatsoever can still train effectively if we know what ranges we can put them in. So this is a very effective tool, like you can implement into your training like straight away.
And with that, with the frozen shoulder thing, say for example, they can only get 60 degrees of flexion, so they can only bring their arm up slightly. Well, what we can do is we can play with giving them all the other movements in the shoulder blade relatively by actually just getting them to move their spine around. We could just feed them a ton of rotation. We can feed them a ton of flexion extension, and we can feed them like a ton of side bending. And I feel like that's probably what's missing the most in training these days, is that actually people are moving their spines in training. We've got a ton of exercises that are most popular that involve around not moving whatsoever. We call them bilateral symmetrical. It's when you're kind of like both feet are side by side, both arms are side by side. You might be using a barbell or dumbbells or something like that to keep you nice and tight. And you actually want to resist rotation as much as possible. And this is where things get tight. Yeah, and we start losing that ability to rotate, which is the ability to move your shoulder blades, which is the ability to move your rib cage and your spine.
Yeah, there's a place with all training to phase things in and out, but if your training looks like the same thing all year round, like just being bilateral, both feet planted, well, you're going to have a trade-off, and one of those trade-offs are you're probably going to lose a fair few movement options. So having periods through your training where you're cycling maybe some more of those single-legged stuff, what we call unilateral work, or times where you alternate and you reach and you rotate through your pelvis or through your rib cage, can be awesome just to restore more movement options back to yourself. And then you can cycle back into your strength work and do what you love. But having those times phasing stuff in and out, it's just having best of all worlds, right? You can play with your strength and keep those more movement options at your disposal. I think that fits everyone, right? Everyone wants to have that movement and be strong at the same time.
Yeah, it's pretty amazing when you see the body as this kind of unit, how many different options you actually always do have. And then you start seeing like there is no reason to not really train with injury. Like we have people train with injury all the time in the gym, and they work around it really well, and they still get a very successful session, and actually something that's not just allowing them to train, but actually improve while they're training still as well.
Give an example of this. So let's say like a standard bench press. So we said that arm pointing down to the ground, 0 degrees. The arm coming up right in front of us, pointing directly in line with the shoulder in front of us, is about 90, and the fingertips pointing up to the ceiling is about 180. So that normal bench press is about like 90 degrees to maybe 80 or 70 degrees. And there's a bit of scap movement involved in that range, and that can be irritating to someone with a shoulder injury. But now, if we do a decline bench where we elevate the bottom portion of the bench, the angle of the arm drops down lower. Now more 70, 60, maybe even 50 degrees. So now they don't have as much scap movement happening through their pressing exercise. So they're still getting all these relative movements that are happening throughout the body, and they can load the heck out of the chest and load those tissues that they need to be loading. So it's just a simple change in position. We can get most of the same stimulus that we would from a flat bench, but we've got this person moving safely and effectively now.
Yeah, and it's something you see all the time in here as well. We get a fair few people with things such as frozen shoulders who really struggle with that kind of range in a flat bench press. We put them on a decline and they get a lot of relief out of that and are able to continue doing chest exercises just like that.
And then after about a month or so, you start seeing that chest grow, which is something that they pretty were hesitant to do at first. We've talking about injuries with the shoulders and issues. It's one of the main reasons for injuries being so common in the shoulder is that the shoulder is a very compact space. It's a very small area for everything from your head and your heart to travel through down into your hands. And if you think of your hands, there's so many nerves in your hands that our hands are designed to be very sensory. So we need loads of different vascular systems. We need loads of blood flow because nerves love blood flow. We need loads of nerves to travel down so we can sense things. We have so much soft tissue, like I explained earlier, that encapsulates that joint and travels all the way down through the elbow to the hand. So it's really, it's common because these spaces get closed up from day-to-day life or for so many different reasons. And that's why we get these kind of like different medical diagnoses of shoulder issues, and also why we get these different movement issues where we lose a lot of range of motion, because we need those joints in that shoulder, them 4 joints, to be able to like expand or open up and close up, muscles to relax and contract, for me to be able to take that full range of motion through the arm.
And a real interesting point you bring there, James, and when we see that injury, we want to look for that like biomechanical lens, like why is this area really compressed and tight and irritating a nerve? And then maybe we can look at reverse engineering and look at creating space and movement versus surgery where we chip away something to create the movement. Maybe we can influence this whole structure, the shoulder, the rib cage, the scap, whatever it happens to be, to create more space. And that could maybe avoid a surgery and get that not just treating the root of the cause, right, rather than just treating the symptom. So we can look at how can we influence this structure to take more variability, more shape, more space, and if we can pick the right movements to do that, we can avoid ourselves like with some wasted time on the sidelines from a surgery or wasted dollars as well.
Yeah, 100%. And it might be a good idea just to put that injury just in black and white. It's called a shoulder impingement. Yeah. So that's that compromise in that subacromial space we were talking about, so that little gap in the top of the clavicle and the scapula. So that soft tissue that we're talking about, because your fingers do so much fine movement, they need fine touch, so many nerves going through there, so much blood supply, so much going through that space. If that's compressed and leads to that irritation and that inflammation, then that can cause that impingement and limitation in the range. And you often see that. We were talking about the rotator cuff before. There's a muscle that goes across the top of the spine of your scapula called the supraspinatus. That tendon of that muscle often gets caught in there. You have a bursa in there as well, so your subacromial bursa, your bursitis is a common shoulder injury that you see a lot as well. And then also, if you know your attachments to your bicep long head tendon, that also goes through that gap as well. So any 3 of those points can often get inflamed by that subacromial impingement.
And it sucks, man. When you know it, you realize how much you use your shoulder. You're like, this thing is meant to move and we use it every day to complete every task we do. As soon as you have one of these injuries, like you're begging for like relief and to try and get movement back because it sucks. So looking after this structure and trying to provide as much movement to the structure as possible is a great way to kind of keep yourself as healthy as possible with it, or up your chances at least.
Yeah, I've had that where I've subluxed my shoulder playing soccer, and afterwards, it's amazing how when I'm in the shower washing my hair, I realize, I put my arms above my head every day without even noticing it. I'm like, I can't wash my hair.
It's interesting that the whole point of the shoulder isn't what you really think it is. It's all about where you're positioning your hand and how important that is for everyday life, just grabbing and writing and washing, all of that kind of thing. Your shoulder needs to be able to function properly to position your hand where it needs to be.
Yeah, it sucks, right? Yeah. Shoulder injuries suck. Okay. You want to go through a few more of these?
Yeah, let's hit on a few other shoulder.
I think we've talked about frozen shoulder a fair bit, so it might be a good idea to clear up what that is. So frozen shoulder, I believe the specific name is adhesive capsulitis, so just sticky shoulder essentially. So it's the thickening and inflaming of that shoulder joint capsule, and that thickening that causes pain and reduction in shoulder activity. So that capsule inside your shoulder that we've been talking about, that gets really stiff, and that's where the name frozen comes from, because it can't move. It shouldn't have all that activity that we've been talking about, all these different movements that the shoulder can do, because that capsule is now so stiff it can't do it anymore.
And you'd be quite amazed when it comes to just tissues in general in the body are actually supposed to be gliding along each other nearly all the time. Like there's so many opportunities in the body for tissue to rub on top of each other. And actually what's supposed to happen in the body is these tissues are supposed to be to roll over each other nice and smoothly. And a lot of that comes down to the fluids in your body. Quite often when we look at a human body in a cadaver, like so a body that's dead and cut open and has been drained of blood, so it's not too messy to cut it open, what we actually see is it looks like a little bit more like joints actually touching each other. But the way the human body is actually designed, that when we are alive, is no joint is really ever touching each other, and problems do arise a little bit more when not even joints touching each other. Before joints touch each other, the fluids in between the joint actually get compressed on each other. So this is actually where quite often we get these kind of pain signals and issues. And sometimes like you'd be actually amazed with how much movement can be improved from things like hydration. I'm not saying that frozen shoulder can be improved with hydration in any way whatsoever, but your mobility can be quite easily improved by your hydration, definitely.
Drink your water, take your salts.
Yeah, definitely. And while we're touching on the movement of the scapula as well, scapular dyskinesis is something that we talked about before. That was those Kibler signs that we talked about that we kind of disproved. So I'll just basically touch on what it was. It was pretty much just 3 categories of different dyskinetic, which just means incorrect movement of the scapula. And there was a study done about 15 years later that completely, not disproved it, but said it had quite low accuracy. But there are definitely still ways where the scapula don't work in the right way that we're supposed to. Like Mitch was talking about earlier with that model of the rib cage and the scapula moving like with your 2 hands. But there are still those dyskinesias, such as a winging scapula as well, that kind of thing that can cause dysfunction in movement.
Yeah, the actual labels that he was presenting were actually like kind of correct. It's kind of like there are these issues that you do see arise with scapula. It was more so his way of testing and everything wasn't actually predictive of real issues. Again, for the reason that he was just looking at like a frozen in time person moving their arm.
Yeah, it wasn't that 4D movement.
Yeah, and we need so much. We need to see so much more. It's actually the shoulder blade is such a complex design that it's extremely hard for a coach or a physio to actually capture the movement of the shoulder blade with just their eye. So what he was trying to come up with, a way to assess the shoulder blades, which is kind of like ineffective.
Yeah. I think you could touch on this one, Mitch. Slap tear. Were you talking about this before? The superior labral anterior posterior tear.
You had one yourself, right?
Yeah, from footy.
Yeah, it sucked and it hurt so goddamn much. And it took. Okay, I want to piss my own pocket here. This was playing rugby, and I played in a very big Polynesian team. I was the only white boy in it, but I did the best tackle of my whole life. Like, it was like the greatest hit I've ever put on, and the Polynesian boys just absolutely loved it. But what they didn't know is I absolutely ruined my shoulder in the process. And when I got the guy and I ironed him out, I reckon I came off second best. I was horrible. I was like done for like 8 weeks, I reckon.
Did you let him know though?
No, not at all.
Good.
I'm just like, yeah. Oh God, it hurt so much. But yes, it's the best tackle I've ever done in my life. And the boys just
staring at him with tears just dripping down your eyes. Like.
Show him nothing. And the boys were going in the background, chee-hoo. But yeah, I definitely ate shit on that hit, and did a light tear in the labrum, and it was extensive to kind of come back from. But you know what, it did, and the shoulder's full function. It's in a very healthy position now, and it just took time, unfortunately, and it sucked during the process, but fully fit.
Yeah,
all done and dusted now.
Yeah, that is caused by that big tension on the long-headed biceps like we were talking about before. That's often caused by things such as throwing, so you'd see it in a lot of overhead athletes like your baseball players and all that kind of thing, but also in, like you said, tackling, even falling. So it's not even athletes, it can be common populations as well, can suffer from those slap tears. Other things like GERD, I don't know if you would have heard of glenohumeral internal rotation deficit. So that's looking at your superior head when it's humeral translation that results in a lack of internal rotation in that glenohumeral joint, that shoulder joint that we were talking about before. And then that last one that we had there as well, the rotator cuff tears are super common in the supraspinatus, that one that we were talking about up top before. And it's an interesting point as well that actually increases in prevalence with age. So in a regular age basis, it's about 20%. But then as soon as you get to 60 plus years, that goes to 50% of people suffering from it. And in 70 plus years, it's 80%. So when I say that they're suffering from it, no, not all symptomatic. So about 30 to 50% are asymptomatic, which is still about half. So a lot of people are suffering from it.
I think it's super interesting as well. There is general wear and tear in the body, and there's definitely certain ways in which you can kind of like look after the longevity of your body, especially, but not not damaging it, not pushing its barrier. I say not pushing yourself too much, but that'd be completely wrong. But the idea is not doing repetitive motions too much. There's a lot of information on repetitive motion. And in these kind of cases, you can kind of imagine how that supraspinatus, like Callan just briefly mentioned, is kind of the one that goes directly under through the subacromial space. So when that space gets closed up, it's nearly going to be the first place that gets pressure put on, and slowly you can kind of imagine it's slowly getting wear and tear throughout the years. But the cool thing is how half of these are asymptomatic anyway. So just bear in mind, I think this is always something really important to know, is that when, if you do get an MRI and the MRI shows up that you have some wear and tear here and there, well, that doesn't have to be symptomatic in any way. The body doesn't always have to experience pain from these kind of wear and tear issues.
Yeah, and I think that brings us to the point of medical diagnosis versus movement diagnosis. So that you're talking about the MRI scanning up and saying, hey, you have a tear in your rotator cuff. But we're saying only half of people are actually symptomatic of that. So there's a 50-50 chance that your shoulder injury was not actually resultant of that rotator cuff tear, and it could have actually been from something else. So working in conjunction with a movement diagnosis, you can more so get to the basis of what that injury actually is.
Yeah, and that's why you want to look at the whole body as a whole, right? Because it can, really interesting things about actually being able to take the arm up and overhead. When I take my right arm all the way up and overhead, well, for me to be able to clear 120 degrees of range of motion is the same as for me to be able to turn my head over and to that side, which is kind of like the ability for me to open up the space in that front of the shoulder. And you find a lot of people just actually can't open up that front of the shoulder, and their pain isn't always going to be from a slight tear. Their pain could just be from the compression of the joints when they do certain movements. So it doesn't always have to be because you have an actual tear as such. It can be that you're actually experiencing pain from more of a pressure build-up or more of a nervous system telling yourself to maybe not use that position so much.
Variability is a beautiful thing, isn't it?
Yeah, definitely.
And that comes down from training variability, movement variability in your sport, wherever it happens to be. Your body to take up more shapes and to be able to, with those shapes, challenge them with load and intensity and volume and all sorts of things is just going to make your body, your structure, a little bit more resilient is probably the word to use. Again, no one's guaranteed to be free of injuries. That's a fallacy. Bulletproofing and perfect shoulders, shit happens. It's unfortunate. But we can have more variability in our structure. It's going to allow our body to make more shapes. If we can make those more shapes and they're pretty resilient and strong and we've trained them with a bit of load, we're just giving ourselves the best chance possible to experience movement the best it can.
And there's so much studies done on repetitive motion injuries. And the idea is that, for example, when Mitch says that variability, well, every exercise, there's going to be it's a spectrum of variability. When I first learned to perform an exercise, that exercise is going to look different in many different ways. So I might be doing a squat and it's actually really obvious to someone that when they perform that squat, that it looks very different because they're just learning the best way for them to perform the squat for themselves. But even when that exercise looks exactly the same over and over again, there is no two reps that are alike. You will never repeat the same rep again. There will be different muscles firing up. There will be different ranges of the joint being taken up. So it can be really beneficial to kind of look at your total movement, through some screening tests, just to kind of get the idea of what kind of ranges you have, and then maybe shoot for opening up some range that you might not have, because this increases your chance of being able to have variability of exercise. Even though the reps look the same, right, you can actually do very different reps each time. Does that make sense?
Yeah, 100%. And I think we were going to supply some way of looking at that shoulder assessment as well with a video at the end. A
couple of videos on the side from this podcast where we're actually going to show a couple of good tests to test your shoulders and then some ways to quickly fix that up. Open it up, open some space for the shoulders.
Shall we talk hypertrophy?
It's the fun stuff. This is
what everyone's here for.
All right. This is where the timestamp is. So we're going to talk about how to get your shoulders bigger, how to get them stronger. It's okay, let's say bigger first. So I think that's one of the biggest influences toward the shoulders, right? You want to see them big and broad and gorgeous and juicy. We're going to tell you how to do that, talk about some of the nuance behind it.
So first up, we discussed at the beginning, right? We don't just have an anterior, medial, and a posterior head of the shoulder. We actually have 7 heads of the shoulder. So there's actually quite a lot of different ways in which you can target these shoulders. And they all have like different paths of the movement. And that's where the way I see it is that lots of people talk about rotator cuff exercises. Well, rotator cuff exercise, any shoulder movement is going to be a rotator cuff exercise. And the shoulder having these 7 heads is actually what really moves the arm around the most. So just generally building some good shoulders on you is going to like help your rotator cuffs. When we look at the anterior shoulder, so we have 3 muscles of the anterior shoulder, and they actually are all going to have different paths. So when you're doing your anterior shoulder training, and Canam's got something really cool to talk about in a second with this. If I'm doing, for example, a front raise, well, a front raise that's going to hit my most inside shoulder is going to be more like a thumbs up front raise, where I'm going to kind of diverge over my nose at the end. So hand down by the side, up and towards my nose. Then I'm going to train a little bit more outside of the anterior delt. That's going to be a little bit more wider angle coming up and towards my ear. And then my last anterior is going to look a little bit more like a lateral raise, but we're still not in that scapular plane yet. And then the scapular plane is where you best hit your medial delt. So this is actually something that you don't see many people do. Like most people, when they do their lateral raises, completely on the side. So their elbow is directly to the side of the body. Well, you're actually best training your medial delt in the scapular plane, which, like I said earlier, for most people, that's at 30 degrees in front of your body. So if 0 was my arms directly to my side, 30 degrees out in front, that's where I want my upper arm to be when I come up. And that will also allow me to get way more range of motion and get way more shortening of my delt as well. So there's so many benefits to that. As well as that is quite often when we go up in this lateral raise, with my arm that's 0 degrees, there's way more chance that, actually I'm going to hit my acromion a little bit more, the top of my shoulder. So when you go up on the side, you have to turn your elbow down eventually, which switches the muscle that you're working. So it's going to make it more of an anterior delt exercise at the top of the movement, which is not going to be that efficient. So bear that in mind, scapular plane for the win with the medial delt. And also the scapular plane does hit a bit of anterior free. So that one, just the anterior delt slightly in front. Yeah. Then we've got the rear delts, and a really cool way to train the rear delts is ideally we love the rear delt row. Like that is such an awesome exercise. And you find that with a lot of people who train rear delts, a lot of people who train back, they have a pretty rubbish row, and therefore they build a lot of rear delts. Yep. Or they aren't very good at hitting their rear delts and they train a lot back. Well, there's different angles that you want to be training when you're training your back. Definitely, so you can hit the different muscles of the shoulder. And I think you see this quite often with, for example, people doing like a lat row, where really you're like, oh, you're probably hitting more rhomboids or you're hitting more rear delt. Well, it's really cool to specify what part of the back you want to hit during hypertrophy. Am I going for a rear delt row where I'm trying to hit the back of the shoulders? Am I going for like a rhomboid row, trap row where I'm trying to get the middle of my shoulder blades? Or am I more going for a lat row where I'm going to take the elbow path maybe a little bit closer to my body? And with rear delt rows, we see the same thing with the lat pull down. So with a lat pull down, I think most of us can picture this. You are going to get some lats, yeah. You are probably going to get some lower traps, but you also can slightly tweak the exercise to hit and favor the rear delts as well. So, and again, like we want all these different paths of movements, and we'll post up some videos of how to hit these different muscles in a second. But these are really good ways to target every single bit of the shoulder, so you can hit so many different movements with the shoulder and hit so many parts of the head.
Bit of volume works nicely with these areas too. There's time for strength, but there's we're talking hypertrophy at the moment. So with these movements, really nice to spike up the volume. Quick one too, a side note, if you want to look at hypertrophy and how to best specialize with this, we have another poddy on building muscle mass. Check that out, talking about some of the training programs that you can kind of use and kind of the diet concerns you can kind of consider when you're trying to put some muscle mass on. But we're going to be pumping some volume on these areas. We're going to be like 8 to 12s, 12 to 15s, getting some real decent stimulus on these areas to grow on. So that's going to be a big consideration. We need these areas to get some fucking stim, excuse me. And that's not necessarily from that sensational feel, but having that right angle, that right line of pull, and we have that right movement selected, and we're getting that nice range with only a couple reps in reserve, we're going to get some nice stim on it, and they're going to grow.
And this is where equipment's going to come in a lot, right? So like every muscle is, every exercise, no exercise is ever going to be the perfect exercise all on its own, because every exercise has a strength curve. So there'll be certain points where a weight becomes more so and certain points where the actual load is deloaded. because of just physics. So when we're using dumbbells, it's never going to be everything you can get from dumbbells. So the mixture of kind of dumbbells, cables, even closed chain stuff where you have your hands on the ground together can be really good to fulfill your full shoulder needs. Can you think of other things, other pieces of equipment that you guys love? Bands can be really good because they actually accommodate the resistance, which means that sometimes with a band row, I can actually pull back and get more resistance at the end. So bands can be pretty useful.
Shout out to the cables. They've been a great investment we've had in the gym in the last couple of months, and I reckon that constant tension has been a beautiful addition to the training.
And the fact with cables, I can step forward and back to just instantly change the angle of pull for the weight. So think of I like to think of it like, just think of a scapular plane raise for a second, where I do take the dumbbells up on the sides. With a dumbbell, at the bottom of the movement, it's actually not going to be much work done. It's going to actually be very easy. And as I get up to the top, it's actually going to become very hard. And sometimes the weight doesn't meet the amount of work you want to be doing. So then the first thing we see is momentum created in the bottom of the movement. And when we see momentum created in the bottom of the movement, you're actually doing quite a lot less total work, time under tension, mechanical tension for the shoulders. So you can do your lateral raise knowing that you're hitting the top of the shoulder or the shoulder in its more shortened position with a dumbbell, and then you can take it over to a cable to hit it from different angles.
Yeah, you can actually get a bit of length at the bottom of the range as well when you're getting that tension at the bottom.
And with hypertrophy, we actually know that like the muscle stimulates better in its lengthened position. Even though the sensation may be greater in the shortened position, there's a lot of evidence to say that the lengthened position is where the magic happens.
On that momentum too, I think one of the common things we see with momentum is using the rib cage or using the upper body to extend and create that last bit of range of motion. So that's something definitely to kind of consider with the positions, that we have that stacked position and the movement is facilitated through the area that we're trying to work. And we're not using the torso or the trunk to lean back and use that last bit of range to get that last bit of momentum to finish it off.
Yeah, with that, I love that. And honestly, I'm most of the time telling people to not use momentum. But I feel that if you can not use momentum, say for example you're doing 10 reps and you can not use momentum for the first 8, then I will allow you momentum for your last 2, because I think that's where you're going to take that muscle truly to the end. But it's a skill that you have to earn that kind of skill with training. Like home it in, get the movement down, get the right muscle burning, and then when you get good at something, you can start doing some dirty reps at the end.
Would you say it's hard to train to complete failure without using that momentum or different orientations at the end?
Oh, yeah, totally. Yeah. I think it's natural. Like your brain has a task at hand that it wants to achieve, and it's going to do whatever it can to achieve that task. So I feel like it's actually good to use some momentum, get it a little bit dirty sometimes, but most of the time not. Beginner trainings, I would not worry about that whatsoever. But later on in your training, you got to get a bit dirty.
I think it's a very common thing. If you're to step into a 24/7 gym or to have someone that's new and hasn't had the feedback, I think you see this extension pattern pop in quite regularly. And it's not the end of the world, right? It's just limiting the amount of stimulus that you want to initially provide to the area. And like James said, if you want to go to those dirty areas, and that's, well, build a muscle, you have to have some decent stim. You have to have some oomph about you to get it done. So it's all right if that's allowed in that last little portion, but like most of the reps and most of the sets should be pretty well controlled.
And it makes the exercise untrackable, because it changes a variable massively. So you don't know that you actually are getting stronger because you might just be whipping your body better through the air. So being able to control your body can make the tracking of an exercise much better. I'm pretty like geeky when it comes to that. When I'm tracking my weights, and I'll be like, last 2 use momentum, 8 reps, last 2 use momentum. And then the next time I'll be like, okay, well, I got 9 without using momentum, and I hit another couple. And on my last set, I'm normally just going to go, okay, I'm just going to take that muscle to failure.
Yep. Where do we see this pattern quite commonly? I would say another one would be like the bench press, right?
Yeah,
when you
press.
change the angle, you change the line of pull by tilting the rib cage up and turning it into a decline bench. So you're changing the tissue that you're originally trying to hit by extending and arching. You can imagine like the lower back's arching, the hips tilting forward. We're seeing more space at the lower back, and it's changing the angle and the fibers that we're originally trying to hit with the movement. I think that's a very common one that still kind of see.
Cannon's got a good study on this one.
Ooh,
When I saw the study popped up on Cannon's computer, I was like, oh, this is fun.
It's a great study. I was also going to say military press is also a very common one. I would say something like that. This study, we're looking at the involvement of anterior delts in bench pressing, and it's looking at different benching angles. So it's got from 0, 15, 30, 45, and 60 degrees. And looking at the different involvements of both your upper pec, middle pec, lower pec, your anterior delts, and then also your triceps. The triceps were sort of negligible at all 6 different angles. They were about the same in terms of their EMG, that's their electrical activity at each. But there was some really interesting data looking at how involved the anterior delts got as you increased your bench. So if you're looking at the graph, which is great, I'm going to try and link this into the podcast so that you guys can have a look at it as well. But it has the highest EMG activity at 60 degrees, so quite a high incline bench. And that's a very linear progression as well. So you can see every time you take that bench up a click, your anterior delts get even more involved. So there's a big jump from 15 to 30 degrees, with 0 degrees being about the same involvement as your middle pecs are. Middle pecs, middle pecs love it at 0 degrees, and obviously upper pecs get peak at about 30 degrees with the drop off at 45. But you can see that the horizontal bench press are similar activities in the pec major and anterior delt, but that incline of 30 degrees, that gets you the good upper pec. And then greater than that 45, that's a lot of anterior delt. And I think, James, you were saying in terms of your pressing history in terms of benching.
Well, when we read this, it's kind of like, this is some good anecdotal information to go alongside with that is, I actually don't have very well anterior delts, like front shoulders development. And that's because when I've always pressed ideally aiming for pecs. So I've always pressed at a little bit of a narrower angle and got like a nice deep range of motion, which is developed. I've got pretty big pecs for my size and pretty small shoulders, so I have to develop the shoulders separately. And mostly because you can really change the angle of what muscle you're using when you have a different joint. And one of the most butchered exercises I think I see is people training chest on a flat to slightly inclined bench with their elbows really flared out.
Yeah, flared is the issue. But that's what I was going to touch on with you as well, is that I am the polar opposite as well. So I have quite an underdeveloped chest but overdeveloped front delts, because for the first year and a half of my training history, I was pressing out probably 80 to 90 degrees where you should be in at about 45 to 60, which is what I'm sure you were doing. But yeah, now I've resulted in the bit stronger anterior delts, because that's what we're talking about, that elbow angle, as opposed to that stronger chest by being in that right ideal angle for bench pressing at 45 to 60. Which
the cool thing about that is you take into consideration my angle on the bench, my angle of my arms, and you can literally target a completely different muscle.
Yep.
And I think it's extremely useful when we talk about repetitive strain that we actually program exercises specifically for certain areas, so we don't have to go into every single bench, every single press you do looks the same, and we just hit the same muscles over and over again.
Interesting on that,
yeah.
It's the same thing with the row, right? It's like you see so many people doing like a lat pull down from overhead down, and they're actually targeting their rear delts a lot more than they're targeting their low traps or their lats. And a slight change up of bringing the hands in, taking the elbows close to the body is going to make it a lot more lat dominant. Yeah, but it also can be an amazing way to build your rear delts. And sometimes just looking at someone's physique, you can be like, and then look at their program, you can literally guess the way that they do every single exercise.
Yeah.
Like you can be, well, anterior shoulders, no pecs, or this guy benches with his elbows flared out the whole time. Loads of rear delts, no big lat development, or this guy pulls on a wide angle on his lat pull downs. Like, that's really, really cool, because you can definitely use that to your advantage in training.
Shall we go into the healthy shoulder segment?
100%. The two big considerations we thought of here is that we're training shoulders for hypertrophy, and then we're training shoulders with actual training considerations of actually having a healthy, very mobile, very free moving shoulder. And we see so many issues in the industry with the way that people train shoulders, and we have been guilty of these in the past as well. First off is that scapular plane is super important, right? The fact that I actually have so much more freedom of range of motion in my shoulder in the scapular plane does make a lot more sense to do lateral raise in the scapular plane rather than in the 0 degree plane. Then it's like, hit all the heads of the shoulder. Like, if you want health, make sure you are playing around with variety. And it doesn't have to be, I hate variety for variety's sake. I like program variety, like controlled variety. Like we're saying, different elbow angles, hitting different muscles, different bench inclines. All these things, like, really, really make a really good recipe for programming. Freeing the scaps, right?
Huge one.
Yeah. Mitch, you go on this one.
Okay, here we go. This is still common. I think most people do this. I was taught this when I first started, and I think it stems from a more of a powerlifting lens. And there's a real positive spin if you really want to move load and you want to go into the powerlifting world. But I will give the explanation for general populations and for everyone. Like, I think most listeners here, the scapula should move in conjunction with the arm as it travels through space. You just lift your arm overhead, you do a couple of empty space presses, you'll feel the shoulder blade has relative motion as the arm goes through space, and it should. We need this to move to achieve the most range in the position and stimulate what we want. But I think a very common training feedback is shoulders push down and retract and squeeze. And what that's going to naturally do, it's going to lift the chest up, it's going to arc the spine, and it's going to put us in this very extended position. Now, with this position, we're really immobilizing the scaps, and we're kind of limiting the range of motion from a powerlifting perspective. We're extending and loading on the spine by a fair bit, but it does create a little bit of internal rotation through the arm, which is good for force output. But for general people, it's kind of not what we want, because we're really limiting the ability of the shoulder to have a healthy relationship with the rib cage and to move congruently, there we go, with the rib cage. And it's kind of really enforcing that immobilization of the scapula. And again, this is just not what we want to see with everyday people. We want the scapula to have a very healthy relationship with the rib cage, be able to move very well with it, and that's about it. That's the big bonus that we want to see with these movements. And immobilizing the scapula, not just with the bench, but with rowing activities, shoulder press activities, it's just something we want this structure to move, to be free, to be able to move its natural path. It's meant to move in relationship to the arm. Why would we deny that purpose?
And I think it's you're thinking highly of yourself if you think that you can control consciously the best movement for your shoulder blades. There's 17 muscles that connect into your shoulder blades alone, and with them muscles, they are being controlled unconsciously, and they have to actually have this most fine-tuned movement. Well, while you're jamming your shoulder blades back, number one, you're using the wrong muscles, right? As my muscles lengthen, muscles like to lengthen before they contract, and you're putting the wrong length on the wrong muscles. But then when you're contracting, you're gonna lose force output. Your brain is gonna actually limit how much force you can create to some degree. And at the same time as well, it's like you can't consciously think of 17 muscles and organize them in the way you want. So it's most of the time, it's actually just best to move your shoulder blades unconsciously. Think about the intent of the exercise rather than actually intrinsically thinking about what your shoulder blades should be doing.
Yeah, more outside cues as to what the goal is.
So we it can be just get a reach. It can be then get your arms as far back as possible, right?
Doesn't need to be more complicated than
actually training through that full range of motion.
Here's a very interesting point too. This is exercise selection can be so important because a barbell bench and a dumbbell bench can do two very different things to our rib cage and our scapula. The cool thing about a dumbbell bench and why it's probably superior for movement and for hypertrophy is our body can naturally, our wrist and our humerus and our scaps can move in a plane where they want to move. And you don't have to overthink the situation. Your body will generally orientate in the position it wants to be in. But the thing about a barbell, we lock the wrist. The wrist can't rotate or move now, and then that has an ongoing flow to how the humerus and how the scap's going to move, and it's going to limit a bit of movement option. And again, not to any degree saying barbell bench is bad, absolutely love it. But if we're looking from a movement lens and a hypertrophy lens to kind of get the best angles we can, that dumbbell bench press is going to be a bit of a superior position.
Yeah, I don't absolutely love the barbell bench press. I think it's way overrated as an exercise, especially more so, fantastic. Use it as a power exercise. It is probably the best way to push the most amount of weight. But when it comes to hypertrophy, I think it's a terrible exercise. For the reason that you actually, a chest exercise or even a shoulder exercise has a lot of range of motion. Your elbows come back and out, and then they come in and forward. And with a fixed hand position, you are probably training about a fifth of that, right? When with better exercise, dumbbells probably still not hitting the whole mark. You're pretty getting three fifths or 4/5, and then a cable can actually allow you to either finish it off or do the whole thing.
Oh yes. Yeah? But the issue with the cable, unfortunately, is a lack of stability. So if you want to get ground and do some cable press, it's awesome, but we can't move it with heavy load. So we sacrifice for the bench, right? Yeah. And then the bench then has its trade-offs and...
Yeah, it's all about training that combination, getting a bit of everything.
Yeah, 100%. Yeah, there you go. So it's but then we do put a lot of emphasis on the barbell bench press when I think that if you actually, I've seen a few studies on it, and I might cite one on this, that of how many injuries are caused by the barbell bench press for these reasons.
And I hate to constantly come back to this point of powerlifting, and still love it, great sport. But there are these fetishized movements, and barbell bench, back squat, and straight bar deadlift are probably these movements that are defaulted in our gym culture, right? I think most people just gravitate to them because they're popularized and they see other people do it.
And they can be impressive as well.
Yeah.
100%.
What do you lift kind of thing. You're not going to compare RDL bent knees.
And with any high performance ability comes a risk to health eventually. Because you're forcing yourself through the same movements. Again, we talk about the repetitive strain injuries and stuff like that. Next up, I think is really interesting is how we didn't really give much love to the traps. But the traps, you have lower traps, you have middle traps, and you have upper traps. And their job is, have they an extremely important job in controlling movement of them scapula. So say, for example, I'm doing a lateral raise, and for me to do a lateral raise nice and high, well, my shoulder has to upwardly rotate. Well, guess what? My upper traps have to control that movement on the other side. Otherwise, my shoulder would just pull my scap off my rib cage. So you have to bear in mind that the traps are going to be involved in these things. And sometimes when we feel too much traps in so this is one of the big things I hear is like, you have females who train and they're like, oh, my upper traps are on way too much. Well, that might actually be because your upper traps are weak. It also might be because the upper trap has to work in this movement. It may be something to do with the shoulder blade. But the worst cue that coaches give for this is they tell them to pull their shoulder blades back and down to stop their upper traps working. That is absolute stupidity, because now what you're doing is you're opening up that shoulder joint too much and you're not allowing your shoulder blade to actually have its natural movement. So there is just much better exercises. Like a good exercise to recruit less upper trap is to do an exercise that actually gets less upward rotation. So it can be like a Y raise or something like that. Yeah,
Read the scaps.
Yeah, we're allowing the scaps to move in their full range, but maybe not getting so much upward rotation from the exercise. With that, when it comes to health of the shoulders, I would also do shoulder exercises that involve rotation. Yeah, that involve side bending, that involve flexion and extension, and just making sure you're not just training your shoulders, but you're also training your rib cage and your spine. And then probably you're going to be using a little bit more of a lighter weight, higher reps to facilitate movement and not create as much compression in the joints.
There's so many cool movements that aren't really touched on this, create this more movement to the structure, like bear crawling on the ground and hands and knees off the ground. You're doing some movement. Flip it over into a crab. We're going to get some different movements opening up through the anterior rib cage, the lateral side bending type of movements. Yeah. And when do you see this? I don't commonly see this at, like, say, 24/7 gym. Like we said earlier, it's going to be more of that bilateral, square, stiff movements the whole time, copying very much that powerlifting structure or that bodybuilding structure.
What I think is really impressive about what we do here, pat on the back, is that we actually have different blocks where we're going to organize a little bit more. Hey, now we're going to give you a ton of movement, and this is going to be a little bit more on building capillary density in the muscles, getting blood flow to muscles, like building a position for a muscle to get, like, to build muscle later on. And then when we actually go into more hypertrophy blocks, we lock you down a little bit more. We want that muscle to create as much tension as possible, so we are going to get you tighter. We are going to have exercises that are a little bit more simplex over complex exercises. But it's actually what we do, it's like the magic stuff is that we actually do a bit of both at different times to get the right stimulus and then layer the stimulus.
Yeah, and that even just comes back to the variety of, again, not repeating repetitive motions all the time, and also just adding variety to the training program that is programmed at the same time.
Yeah, like you want a bit of repetitiveness for a while, but you just don't want to be repetitive for too long.
All year round, yeah.
You want some variety, but you just don't want variety for variety's sake. Yep.
Some uncommon areas touched in training the shoulders. Plyometrics. You see a fair bit of this through the gym culture about hopping, jumping, and using lower body emphasis with plyos, but this can be done with the upper body as well. Throwing things, landing on the palms and pushing off them, exploding them. This can give us great qualities to our shoulders as well, and probably quite an untouched area to shoulder training.
100%, and structure dictates function. And if you look at the structure of the whole human body, in the proximal areas, like that more trunk-based areas, the muscles are dense, they are big, they are made for being strong and explosive. And as we get closer to the fingertips and the toes, the muscles become smaller, more many, and they become more elastic and more soft tissue-y. And the idea of that is that they are designed to be loaded with high impact forces and then share the load up through the body under control. And this is just like, well, you want to train these things. These are, if there's structure dictates function, then we need to train the function of the body.
Yeah, we talked about giving yourself the best chance at survival and longevity of these muscles. This is the way that you're going to do that functionality. You'd see most injuries like your subluxations, your dislocations would happen from things like that.
Yeah.
It can be trained in plyometric style activities.
I'll give you another quick training one that you can implement, and that's reaching. Like, that's the ability, like with a row drill or whatever it happens to be, is let that arm punch all the way to the ground. But you got to keep that structure of the torso in play, and you'll feel the back of the shoulder, the scapula will travel along and do what's called protract, will come forward as the arm fully lengthens. And having that arm in that fully lengthened position, again, that lengthened structure is going to allow us to load more tissue and get more stimulus, which is great, but it's also allowing the scap to go through its full range and be free with its movement as well. And that's a cool, like, principle that applies to so many of our training positions, from rowing to pressing to alternating, whatever it happens to be. To have that ability to reach with our positions is a cool thing to be integrating with movement.
And yeah, the interesting thing about that as well is that most exercise that we do, we leave the shoulder blades on the back side of the body. And very rarely do we actually let the shoulder blades come up and around the body. And the cool thing about what the shoulder blades do when they come up and around the body is they squish you from side on and they open you up front and back. So it's actually it's really, really healthy. When we're doing a lot of benching, a lot of heavy exercises where we actually end up squishing our rib cages front back, well, reaching exercises can be the exercise that starts squishing you side to side again and reorientating, rechanging your rib cage shape to give you that kind of that rotation, that side bending, that flexion, that good overhead movement all back, right? So what Mitch said there is just like that is actually, that's real good medicine. For exercise.
I love what you just said there quickly too, James, with like pressures pushing us front and back. I think another, again, maybe I'm just in a bubble, but one of the things I see quite commonly is, if I bench press X amount of times, it means I need to do X amount of back exercises. Well, let's understand, like a bench press, for example, is squishing us front and back. If I unrack the bar, that load's coming down on my rib cage, that pressure's coming down, and guess what? There's equal and opposite forces happening. I'm getting squished from my front, and the bench is pushing me from the back as well. So doing these extra press exercises and following up with more compressive anterior to posterior back exercises, I'm just squishing my whole structure front and back and reinforcing that pattern consistently.
What an amazing point, because really, rather than have these, if I had to come up with this kind of dichotomy of exercise and put a point on it that much, I'd be like, yeah, well, if I'm benching and rowing, I should be side bending and rotating to a certain degree, or side bend, or doing exercises that are compressive side on, like side planks, or rolling exercises to counteract, rather than just squishing myself bilaterally, symmetrically front back.
Yeah.
I need more of this, more front and back compression.
When you do a heavy row, your shoulder blades come in tight and push you forward. And if you're on a bench on the front or something for stability, you just get squishing yourself front back more. Yeah.
And these pressures have to go somewhere. These pressures go laterally and they push out to the side. And we're going to have skeletal adaptations to where that pressure is going. So as we said earlier with that, the rib cage and scap relationship, how they're kind of sitting curved on each other, if we're constantly doing what we call anterior to posterior compression, front to back, that pressure has to go somewhere, and we lose a bit of our shape in our scap, and we lose that connective cohesiveness through the scap and the rib cage. It's a decent trade-off.
Yeah, and I think it's an important thing to consider, and I think it's something that is really not considered in training very much, and it should be. I think that is everything.
Hopefully, there's more to go on this, and unfortunately, our time's getting cut short here, and there's more we could do.
Well, off the back of this, we want to do some talks on the neck. So let us know what you want to hear about neck, forearms, hands, knees and stuff like that, because these are all connect as well. So it could be really interesting to play around with this stuff.
It's been an absolute pleasure. Check out the videos in the link. Again, like, subscribe, engage with the content. Let us know what you want to listen to. Share it if you think anyone needs to hear the stuff about shoulders and learn some good tips and tricks about it. Check up the warm-up, or check up the assessment video first. See what ranges you have. Then see how to implement a really smart warm-up to facilitate more ranges. And then go do our hypertrophy program that we're going to put on and get those shoulders nice and jacked and big.
Boom.
Catch you later.
Sounds good.
See you in the next one, guys.
See ya.
Boys.